Welcome to the business podcast of the American Chamber of Commerce in Australia. AmCham business podcasts are hosted by Dr. Duff Watkins. Duff is a director of Exec Search International, an author, and is also on the AmCham Council of Governors. AmCham, bringing business to you.
Hello and welcome to the business podcast of the American Chamber of Commerce in Australia, AmCham, bringing business to you. Today we discuss your health and innovation. My name is Duff Watkins, and I'm your host on the AmCham Business Podcast. Today, our guest is Andrew Wiltshire, Director of Corporate Affairs for Medtronic. G'day, Andrew. Good to have you on the show.
Hey, Duff.
Andrew, you've had an interesting story. I'm going to tell people about your background, because I know you started off as a registered nurse, then you entered sales for Medtronic, and then you became drivers of individual businesses, then you became a general manager, and now you're heading corporate affairs, that is dealing with the government, and you also have a global role in that. So because you're dealing with corporate affairs, that's my first question. Health seems very, very political. I mean, with every passing day, we've got health and technology and government regulation are tied together. You can't talk about one without the other. We have, you can just look at Obamacare's introduction in the U.S. to see how political it is. We went through it here in Australia with the introduction of Medicare. What makes health so political?
That's a really good question. I think health is a universal need. It's something that everybody is important to everybody. It's important to every citizen in every society. It's also something that I think governments find quite a challenge because there's many vested interests in health. And health is, frankly, it's very expensive. So it's one of the major big-ticket items on any government's budget. Mm-hmm. And then, you've got groups, you've got patients, consumers of health. You've got doctors and nurses and various other health professionals. You've got hospitals, private and public hospitals. You've got health insurers. You've got government payers. You've got companies that innovate and develop products to treat people's health conditions. So there's many different players, and everybody has their own stake in that game. So I guess that's one of the reasons why it gets political. It's emotional. You can always bring a great story up in media about health, and either a great story about how somebody's life has been changed and improved, or a terrible story about how somebody's missed out on healthcare. So it's something that's very easy to make a story out of, and it's also something with many interests in it.
Mm-hmm. Many vested, moneyed interests.
That's true, absolutely. And as I said, health is one of the biggest budget items for any government. Mm-hmm. And every government, the challenge for every government is trying to get the most health they can for the dollar that they've got to spend. Mm-hmm. But they've got many voices in their ears telling them how to spend that money. So it's a difficult challenge for any government. I guess nobody should envy any health minister anywhere in the world.
Yeah, and as you say, it is pretty emotional too. I mean, what you're pointing out is something that consumers tend to forget. Health is a business, and it's an industry as well.
Absolutely, yeah.
And like any business that has certain commercial interests at play and competing with each other.
Yeah, no, absolutely. And I like to think and hope, and certainly within our organisation is very much driven by outcomes for patients, and we delight in, and every year we bring a number of patients in to talk to our whole company all together, and what brings us to work every day is the outcomes for patients. But you're right. I mean, the innovation in health is driven by companies seeing an opportunity to make a profit from that. Mm-hmm. Everybody involved in the health system, gets paid. There's private interests in health, there's public interests in health, but even in the public interests in health, it's all about I have a budget, I have to run my institution, I have to run my hospital, I have to run my healthcare system. I have to know where that money to run that is coming from, and I have to know what the expenses are in there. So, like anything in life, money's involved, and there's a budget that everybody has to work to, and there's money that has to be spent.
Yeah, money involved. Yes, I've noticed that in most things, money is involved. Andrew, you're the corporate governance guy. Now, let's see if I understand your job rightly. Mm-hmm. Medtronic sends you down to Canberra, or it could be any capital in the world, and I know you're involved in a global aspect. And it doesn't matter where the capital is. You go down there, and you're dealing with the politicians, the government, the regulatory agencies. What's it like?
Well, look, it's a very interesting world. I personally really enjoy that world, but it's all advocacy, all negotiation with government is a long-term process, and it's about all people in government, both at the bureaucracy level and at the political level. It may surprise people to hear, but they actually are in it because they care and they do want to make a difference. It's just, I guess, everybody comes at it from slightly different angles, and they have to look at the people who are providing them with information and weigh all of those bits and pieces up. So it's a long-term process, but it's about looking at where the public good is and seeing, well, can you make a good argument to say that the thing that I'm advocating for does make a difference in terms of outcomes, that it does improve the health of Australians, that it does make a difference in the healthcare system, and that it does change and improve the healthcare system. And you're going to be much more easily onto a winner if you can go to government and say, I have something that will improve the health of consumers, and that it's going to cost you less money. That's the holy grail.
Their ears prick up at that. Okay, well, you told me, I think it was a few years ago, actually you gave me a ray of hope, because you said you go down there and you're talking to the politicians and they're seeking information from you, and you said, despite what unenlightened consumers like me see on the television, they're actually pretty friendly. They deal with each other, they have lunch with each other, they know each other, they work with each other, and although it may not appear that way. So you're an insider. What sort of goes on down there?
No, look, that really gave me hope when I first started doing this as well, because like everybody else, I see what happens on the news and I see them, throwing abuse at each other at question time and, throwing, lobbing bombs at each other in media, outtakes and so on. And when you get there and realise that, really the majority of people there are genuinely there because they believe in what they're doing, and that there's an awful lot that goes on in the background. I don't know the exact figures, but I think it's something like 80% of legislation goes through in a bipartisan way without an argument and votes against it. And there's many committees. There's many committees on all kinds of areas, including health, that are bipartisan committees where people get together, figure out problems, come up with suggestions and solutions and ways to move things forward. So. There will always be the headline argy-bargy because that's how politics is played. But it does give you a little faith when you figure out in the end that there are a lot of people who really care and who are trying to do the right thing, and how often they actually do work together. They may not like you to know how often they actually work together, but they do.
Okay, well, it'll be our secret, until I tweet it, that is. So the politicians who are involved in the health system, they're well-meaning, they have good intentions. Some of them are pretty skilled, I'm sure, at least the ones that I've met, pretty knowledgeable.
Absolutely.
And so and they're listening to all these competing interests, competing priorities, some of whom are pretty articulate because there's finite resources. It's, the pie can only be cut so many ways. So what does a guy like you do? What do they rely upon somebody like you to do?
So I think that's a good point. So I think they, as politicians, they have to rely on the systems and processes they've got in place within their departments and various committees and things that they have set up to advise them on that. But the reality is that doesn't always translate into what happens in the real world. So when these policy decisions translate into, if you're a health consumer and you go in to see your doctor, how does that policy decision actually play out in real life? And sometimes it plays out better than they expect it to. Sometimes it plays out, not like they expect it to. So I guess people like me have an opportunity to go in there and say, this particular policy or this particular system that's in place, it's not working for these reasons, and people are missing out on something that could make a difference to their lives because this system isn't right. So then what I try and do is say, if you changed your policy in this way or adjusted your policy in this way, it would allow people more access to these kinds of life-saving and changing technologies.
Well, speaking of technologies, I know your employer Medtronic is very big, very, very big on innovation. in medical technology, things that affect consumers, that is, people like me, day in, day out. And one thing I know about business is that change is very rapid, and technology innovation is usually pretty fast. Does that have an impact?
Yeah, it absolutely does have an impact, and it's actually a real looming problem. It's a current problem, but I think the wave of change in technological development is going to be a real problem for governments all around the world, because generally health works in very fixed ways, and policy works in very fixed ways. We have a regulatory system that looks at how products are accepted into the market and monitored once they're on the market, and we have a number of systems and committees and processes which evaluate technology and then make decisions about whether government should pay for those. But they're very fixed. They look at things in a very fixed and in some ways outdated way. They are very hospital-centric or existing system-centric. If innovation, and I think if you look at an organisation like Medtronic, we make medical technology. You might ask us what's the next great thing, and you'd expect me to say, this great widget that we've got that will do this amazing thing for you, and we do that, lots of that. But actually, I think the innovation is coming in the systems that support and the processes that support that technology. So I think our healthcare system is very fragmented. I think because of all of those vested interests we spoke about, you'll find that federal government will look after that, and a private health insurer will look after this, and a specialist will look after that, a nurse will look after that, and your pharmaceuticals will come from one place and another. But that means that health gets quite fragmented, so you don't get the most effective and efficient journey through healthcare. So I think the innovation is going to come in things that both help pull those systems together, make them more efficient, but also, to be frank, healthcare in hospitals is expensive, and arguably it's not the safest place to be either. Hospitals, do a brilliant job of saving people's lives, but things happen in hospitals as well. Infections happen. It's that kind of environment. So anything that we can do to prevent people from getting to hospital, to, if they need some kind of treatment, trying to provide that treatment outside of hospital settings, and once they've been to hospital, once they get out of hospital, trying to prevent them going back into hospital again. Those are where the real advances in health are going to be. But unfortunately, some of our systems aren't set up to deal with that.
Okay, so if I understand you correctly, then so the technology innovation occurs rapidly, and that's good, and that's fine as is. The real problem comes when you take that fast-changing technology and apply it to kind of a reasonably stable and inert system, which is, I as you were saying, I was thinking of, it's like going from taking a whole country from the old analog phones to the digital technology. Even in a small country, reasonably small country like Australia, we adopt technologies very quickly. But compared to, say, a bigger country like the U.S., it's like turning that oil tanker around in a river. But what you're saying is the technology impact will not be the latest gizmo widget thingamabob, but it will be something that addresses the whole system. Yeah,
I mean both the latest thingamabob and something that addresses the whole system. So the reality is, innovation in healthcare, particularly in sort of electronic healthcare, that's really, the wave of that is just coming at the moment. That will connect those systems together, but the rate of that change is, like the telephone example is a great example. I mean, would we be where we are with the generations of technology if every new device that came along or every new app that came along had to go through a 2 to 4 year evaluation process and a decision process about whether people were going to pay for it or not before the next one could come along, And that's the problem with where we are now. And also, you have perverse incentives. So, for example, a care that could be delivered out of hospital, if we move that to a setting where it could be delivered, in hospital, and then we move it to a setting where we could deliver it outside of hospital. But the payment for that only occurs in hospital. You'll probably still get that in hospital, and that doesn't make sense. But that's just because that's the way our systems are set up, and those are the systems that are in place to advise politicians on what policy decisions they should make and so on. So if those systems are not fast enough to adapt, we're going to get left behind in some of that, and we're not going to get to take advantage of all of the benefits that this rapidly changing technology can bring to us.
So when you talk about the system, we're talking about even before you go into hospital, that is, even before you enter the health system, symbolized by the hospital. And also you mentioned payments as well, so there's the business aspect of it. So it's from before you entering, going through progressing through the system, and at the end is the payments. So that...
Yeah. So, I mean, and maybe even take it a step further back than that. So, you know, if a new technology is going to come to Australia, for example. So, first of all, an engineer or a doctor or somebody comes up with a great idea. You need to then develop that, prototype it, build it, test it, put it through clinical trials, do all the things you need to do to make sure that it works, figure out if you can manufacture it. Then you have to bring it into the country, and if it's a medical device, then it has to be evaluated by our regulator, the Therapeutic Goods Administration. That process can take 9 months to a couple of years, depending on the technology. Then if we want that to be paid for by some of our existing health systems, then it gets evaluated by things like AmCham and PBAC and the Prosthesis List Advisory Committee, all of these committees that do this. Some of those processes can take a couple of years as well. So that's potentially this technology may be 3, 4, 5 years before it gets to you. Then you have to figure out where in the health system that's going to be delivered. So as you said, nothing comes for free. So somebody's got to pay for that along the way. Somebody's got to also pay. So, for example, the doctor who has to perform the surgery or the procedure that's involved with that, they also need to get paid along the way. And there's also systems for evaluating whether they should be paid or not. So, there is money involved in the system, and if we put as much of the investment as we possibly can in the front end, that's usually where it's cheapest. The further down that system you get, the more expensive it gets to be, so that if you end up in an intensive care unit, that's about as expensive as it can get. So we're trying to make sure that...
So it's cheaper to persuade me not to smoke, for example, than to deal with me in the critical care unit.
Absolutely, yeah. And once you already have a chronic disease, then it's much cheaper to manage that well outside of hospital than have you poorly managed and end up in hospital 2, 3, 4, 5, 6 times a year. And that's, again, I don't have the exact figures, but it's something like 80% of healthcare expenditure occurs in the last, part of life where you end up with a chronic disease, in and out of hospital all the time, in and out of intensive care. And I think, again, health insurers say that something like 80% of their costs come from a tiny percentage of their patients who have chronic disease. And again, the challenge is managing those people well to keep them out of the expensive parts of the healthcare system, which is also... It's not just about dollars. It's actually better for you as a patient as well.
That reminds me of decades ago when I used to work in psychiatry. We were going through this, and the big push was to take the patients out of those hardcore psychiatric hospitals where I worked, put them in the community, and for one, because it was cheaper, which is not to be overlooked, and second, this is the most important, because it's healthier. Now, ironically enough, fates conspired so that I actually ended up living next to one of those houses, or not next to, but across the street. So I actually had a chance to see those patients in the community, the ones that I used to treat, and it was. I mean, you could see them interacting in the community, and they would go to have coffees and sit around and do it, just interact like normal people. And better for society was my conclusion.
Better for society, better for an individual. I think. There are exceptions, but most people feel better and healthier when they're in their home environment, surrounded by their friends and family. People are also, they're less exposed to infections and so on that you can get in hospital, and they're often more active when they're at home, which is generally in most Most health conditions is better for you in terms of your outcomes. So the more that healthcare can be delivered in the lowest intensity setting that we can practically put it into, generally speaking, the better it is for the outcomes for the consumer and the less expensive it is for government.
So it's just smart,
Absolutely.
economically and health-wise.
Absolutely, and that's one of the challenges in healthcare.
Okay, well then we've talked money, we've talked systems. Who are the winners and the losers in this process that we're describing?
Well, I mean, I guess it depends which part of that, because it's a huge process we're describing. But I think if we're talking about the pace of innovation and the systems that deal with that, I think one of the problems is at the moment there's very few winners out of that, and I think increasingly we're going to see that that's going to be the problem, because if those systems don't catch up, some of the things we've been talking about before is that we don't get to take full advantage of those technologies, which are both effective for outcomes and also cost effective. That means that we're continuing to spend more on our healthcare system. One of the problems with that, though, is it's kind of a hidden problem. So it's a complex issue. Most people are not insiders in health and don't understand. So they may well not even know that they're missing out, or that there could be a better solution for that. So that's actually a real problem. And then I think finally, Australia is about 2% of the world market for healthcare, for medical devices, for pharmaceuticals and so on. If we get multiple generations behind in terms of technology, most organisations can't continue to run manufacturing lines just for a 2% of the world market for something that's 3 or 4 generations behind. You can't imagine Apple still selling an iPhone,
just for
2,
us.
just for
Just for us.
Actually, maybe the market's big enough that maybe they could for an iPhone. But for many areas in health, particularly in medical devices as opposed to pharmaceuticals, the potential, patient population who could benefit from that is sometimes quite small. So again, if there's a big barrier to accessing it, or if there is a big lag behind in terms of generations of technology, some of that stuff just won't come to a country like Australia.
And that's interesting to me, because Australia is internationally known for being early adopters. In fact, rabid adopters of anything that's new. And you're saying that if we don't adapt quickly enough, we're simply in danger of being left behind.
No, that's absolutely the case, and I think we're not too far behind at the moment. I think there's definitely some things where we've seen these things play out in small areas. I don't think we're a long way behind now, but I think from a policy perspective, Australia is about to be challenged by a very big wave of technology in areas like telehealth, in terms of connected care, in terms of less invasive, minimally invasive technologies that move people outside of their existing healthcare settings. We've already got some small examples where that's causing issues at the moment. I think we're going to see a lot more of those. So unless from a policy perspective we get that those settings right and those systems flexible enough, and the systems shouldn't just be gatekeepers, they should be systems which can actively look for promising technologies and solutions that we should be actively pushing out there to adopt, rather than just a gatekeeper to say, yes, you, no, you, yes, you. Because that's the way we're going to get to take advantage of the real benefits that are coming from some of these things. But when we have fixed, rigid, slow systems, we will get behind.
Who's doing it right?
Well, that's a really good question. I think there's no one place you can point to say that they're doing everything right, but I think there's certainly some examples of people who are doing smart things. So, we'll point to New Zealand, for example, and to point to their regulatory system. So, in New Zealand, there is actually no system for pre-market evaluation of medical technologies. They don't have the equivalent of the pre-market part of TGA. What they do say is, we're 4 million people. We can't afford to have one of those. But you know what? Every one of those technologies is already being assessed in Europe, in USA, in Japan, in Canada. So what they say is, tell us you're selling it on the market. So you've got to submit to them and say, I'm selling this product on the market. The hospitals are not allowed to buy one of those products, or the health system is not allowed to buy one of those products unless it already has a registration somewhere else. So New Zealand instantly has exactly the same level of regulatory safety as everybody in Europe or US or so on has, and it's cost them nothing to run that system. Then they monitor that technology once it's on the market. That's so basically as soon as you've got
so
a
they
product,
cut out the red tape basically.
as soon as you've got a product ready to sell, that's right, exactly. Use other people. So when it's ready to sell somewhere else, it's ready to sell in New Zealand, and New Zealanders get access to that technology instantly. I think some of our healthcare systems take up to 2 years to evaluate something as to whether we want to pay for it or not. I think we've seen systems around the world that can evaluate that in weeks rather than years. I think that's important. I think one of the key things is, in terms of the question of, is it cost effective? Some places in the world are looking at coverage with evidence development and saying, okay, you don't have all of the evidence on that yet, but it's promising, so we'll start paying for some of it, but we're going to monitor that very carefully, and if it's not delivering, then we're going to stop paying for that. I think that's another way of looking at, how can we rapidly adopt technology, but also make sure that we're getting the value for money that we're expecting.
Almost like a trial or a pilot.
Absolutely, absolutely. I think we are seeing some healthcare systems around the world that are actively reaching out to private industry and saying, if you've got a solution, we'll pay for it, but we're only paying for outcomes. So rather than I've got this great thing, I'm going to give you, $10 million up front for it. They're saying, you can come in, you can trial your system and your process, and when you get the outcomes, we'll pay you for it. Again, that's another way of a flexible system that is focused on outcomes for patients, but also provides some certainty for government that they're going to get what they're paying for. So there are systems around the world in parts that are starting to adopt pieces of this. It is a challenge all around the world, but it's something that we can look to all of those individual good examples.
What's Medtronic working on now? That's what's the innovative thing coming down the track from Medtronic?
Yeah. So I think, as I said before, I think you would expect us to say it's the latest widget, and there are.
That's exactly right. I was expecting you to say that, but
and there are. So things like all of our implantable cardiac devices, pacemakers, defibrillators, and so on. All of those devices can now talk to the internet, send all of your information. If there's something going wrong, they can potentially even send a text message to your doctor saying there's something going wrong. That's exciting. I think we've got monitoring and diagnostic devices which are now injectable, so that you could have 3 years of cardiac recording from a little injected device, which again can talk wirelessly to the internet.
You inject a device into a person and it talks to the computer or...
Yep, correct. And it can monitor your ECG and again tell your doctor if there's something going wrong. So those are some of the cool widgets. But actually I think some of the most interesting things are we're increasingly looking at whole health systems and seeing where our technology fits into those systems, and if we can actually improve the whole system right from prevention and diagnosis through to treatment, and then after treatment making sure that the outcomes are right, that people stay out of hospital and don't go back again. And we're investing in both technologies, so home monitoring technologies, call centres for person-to-person interaction to make sure that people are monitoring their health properly, and the machine can tell you today you've put on a little weight, so the call centre calls you up, this is if you've got heart failure. That can sometimes mean you're developing fluid. That means you might end up in hospital in 3 or 4 days' time. They can give you some coaching that helps you to sort that out without going to hospital. Some of those kinds of things. Looking at care pathways, looking at making sure that once you're diagnosed, or even before you're diagnosed, that you go through the most effective and efficient pathways to diagnosis and treatment and follow-up. So that, to me, the technology is very cool, and we'll always do that, and we love that, but we're actually looking at the whole system, and I think that's where some of the real innovation will come in the future.
This is what I'm picking up today. See, that's why I'm interviewing you and not the other way around. See, I'm a small picture guy. I'm looking at the cool stuff that's coming down the track, and you're looking at the whole system, the whole process.
Absolutely.
Which will have societal impact.
Absolutely.
Okay, let me just get my crystal ball out here. I want you to grab this hefty thing here. I want you to gaze into it, Andrew. I want you to do your best to predict the future. Where are we going as a society?
Yeah, so I think some of those things that we've already mentioned, I think the technology that pulls all the pieces together is going to be the answer in healthcare in the future.
Do you have an example of that, by the way?
Again, I don't think we're fully there in terms of it all pulled together, but I think some of the whole idea of paying for outcomes is where we may well be pulling. So somebody might say, I can pull together all of the fragmented pieces of the healthcare system for you. I can promise you for the patients that I'm looking after, I will give you an outcome. Those patients will be better. They'll stay out of hospital. They'll be active in the community. They'll be productive. They'll be well, and you'll pay me for the outcome that I get. Mm-hmm. So I think in the long term we're going to see some of that. I think it's going to be important in that patients feel empowered in that as well. That consumers feel empowered in that and have some ability to choose. Because I think increasingly people are taking an active interest in their healthcare, and they're not going to accept just somebody else telling them how to run their health. But I think they will appreciate people who can help them navigate what is a very complex and fragmented system. So I think that's where some of the future is. I think it's also we're going to see in terms of systems, the systems I was talking about in terms of the regulatory systems and the evaluation systems, I think we'll reach some level of a crisis point, a tipping point, where they're going to have to say we can no longer be so rigid and that we need to be much more flexible and look at delivering healthcare in different ways. Having said that, I think we don't want to throw away what Australia's got in terms of our healthcare, because it actually is one of the best and most effective healthcare systems in the world. I mean, we spend, I think probably a little less than the OECD average or around the OECD average to get, really good, better than average outcomes in terms of health outcomes, as opposed to, for example, the United States. In the United States, they're spending huge amounts, probably double that, and getting only about the same outcome. So I think we don't want to throw away what Australia is very good at, but we just need to make sure that we're well positioned to take advantage of the real wave of innovation and that's coming.
Okay, we'll finish here today. Ladies and gentlemen, you've been listening to the Business Podcast of the American Chamber of Commerce in Australia. Our guest today has been Andrew Wiltshire, Director of Corporate Affairs for Medtronic Australia New Zealand. AmCham, bringing business to you.
You've been listening to the Business Podcast of the American Chamber of Commerce in Australia. This podcast is supported by Lenovo and VML. Lenovo is one of the world's leading personal technology companies, producing innovative PCs and mobile internet devices. Lenovo, for those who do. VML is a full-service digital marketing agency that can take you where you want to go. Everything we are is in everything we do.